Have you ever wondered how the effectiveness of medical treatments is evaluated? The answer lies in the evolution of a fascinating scientific method known as randomized controlled trials, or RCTs. The journey begins as early as 1948 when the British Medical Research Council conducted the first RCT. This was to evaluate the effectiveness of streptomycin in treating tuberculosis. This marked the birth of RCTs, setting a precedent for what would become the gold standard for evaluating the efficacy of medical treatments and interventions. Fast forward to the 50s and 60s, RCTs took a front seat in the evaluation of new drugs and treatments for various diseases. Diseases such as cancer, heart disease, and mental illness were put under the scrutiny of this robust method. The 70s saw a shift in the use of RCTs. They were now being used to evaluate the effectiveness of preventive interventions. Vaccines and screening programs were put to the test, further expanding the scope of RCTs. The 80s and 90s brought forth a new frontier for RCTs. The effectiveness of new surgical procedures and medical devices was evaluated using this method. The versatility of RCTs was shining bright as ever. In the 2000s, RCTs took a turn towards evaluating the effectiveness of behavioral interventions. Cognitive behavioral therapy and mindfulness-based stress reduction were among the interventions evaluated. In recent years, the scope of RCTs has grown even wider. There's been a growing interest in using RCTs to evaluate social programs and policies. Educational programs, job training programs, and anti-poverty programs have all been subject to this rigorous scientific evaluation. Over the years, the methodology and application of RCTs have also seen considerable evolution. The use of placebo controls has become more common, and the blinding of participants and researchers has become more rigorous. There's been an increased focus on patient-centered outcomes, such as quality of life and functional status. There's also been a growing interest in using RCTs to evaluate complex interventions, such as those involving multiple components or delivered in multiple settings. In conclusion, RCTs have evolved from a simple method of evaluating a single drug to a versatile tool capable of assessing complex interventions across various fields. They have become the cornerstone of evidence-based medicine, helping to ensure that treatments and interventions are safe and effective. The evolution and importance of RCTs are a testament to the power of rigorous scientific evaluation in driving progress in medicine and public health.